Hi, I'm Kristy.
And I'm Ashley.
And we are your sim crew. Today we're going to review the Billy Barton simulation for third semester nursing students. I will go over the room and Ashley will review the simulator. All right, so first things up, we will be in room 1201 for this particular semester. We'll be in this room. And so we're just going to kind of review the room. So Ashley's just going to pan the room a little bit with the camera so you can kind of see how it's set up. We have our med room area over here, and we added a little bedside table so that you guys could have some more space to look at your TAR and your MAR and your orders, and then review your critical assessments while you are determining what you're going to get for meds on the workstation here. Your meds are going to be right here in the same med cart that they're always in, with a coordinating tackle box, and then all of your supplies to give meds are going to be in the coordinating shelves. Excuse me. Something that's going to be in this simulation is are going to be these black carts. They may come into play throughout your simulation. So when you see a cart, it probably coordinates with what is in the orders of the patient chart. We have directions on here that come from your skills, from the skills lab. So whatever you are expected to do for skill checkoff, you are expected to do here in the sim lab. Okay, so whenever you get a cart, you will perform the skill exactly as you are supposed to do in skill checkoff. All right. So when we are looking at this side of the bed here, we're never going to stand on this side of the bed, because then that means your back will be to us, and we don't want to have your back to us. We want to see your face. So we have a chair here. It says do not move this from this spot. That just simply means that the chair is here so you don't stand here. And we also might have an actor who will sit in this chair, okay? However, if you need to get to the IV pump, which you will, then you could move the chair slightly just to get to it, but you should only be over here to mess with the IV pump and then move. But other than that, there's no reason to be standing over here. The IV pumps will be utilized in your simulation. Usually we don't utilize the IV pumps, but for this particular simulation, you will use the IV pumps. They will be turned on. You will program them. And this can be done with your peers, okay? And then we have a bedside monitor right here that's covered up. You see it is covered up. After you get your first round of vitals with the patient, then you can ask us if you can uncover the monitor, and then you'll see the vital signs on the monitor as you're doing your care through your simulation. In this room, we kind of have it set up the same way that you're normally used to. We have a bedside table with some of his supplies. We have over here, we have your garbage cans, blue for recycling, black for trash, and then of course meds and stuff like that are going to go in here. Now if you are using syringes to push meds through an IV or through like a central line or something like that, those syringes, because they don't have needles, can go right here, okay? But anything that has a needle on it is gonna go in the sharps container, right? Ash is gonna show you, right there. Right there by the sun clock, where it always has been. Needles always go in here, okay? Also over here, we have a medication waste container. In the event that you have to waste medication, as well as a display of how you're going to do that. And then, you have your gloves and your sink. Remember, we're not going to change our gloves 45 times. We're just going to verbalize, say we did it, and move on. If there's anything that you need in the simulation and it's not out for you, it's probably in the patient supply cabinet over here, where it says patient supplies. Same cabinet, yellow sign. Other than that, let me see. The head walls function. Your head walls up here, you have your oxygen, your air, your suction, everything works. You are allowed to use that. And I think that is it for the room, other than you'll do your first 2 checks over there where your med stuff is, and then you'll do your 3rd check over here on this side of the bed with your patient. All right, I'm going to turn it over to Ashley so that she can give you some information about Billy here, and then we'll go from there.
Perfect. So this is your patient today, or when you come in, it's going to be Billy. Because of his cords and how he's plugged in to run, we ask that you don't raise the side rails or pull on any of those cords. So you can see there's a blue cord, a black cord. We don't want any of that to become unplugged or pulled on from the simulator. So just don't pull or raise the rails up. You can verbalize that if you would want to. Don't raise the head of the bed. And then if you do have a question about it, you can always say sim question and we'll walk you through it. Verbalize any kind of movement of the patient or the bed just so that we can make sure that no cords are getting pulled on. As far as the simulator goes, he was in a car accident. Your patient today was in a car accident. So you can see that he does have some areas on his skin that would be relevant to a patient who has been in some kind of accident like that. It's kind of like what you see is what you get. So if you're looking at that, you could assess that and ask him about it as well. He is wearing oxygen, and as Kristy said, the walls up there function, so that will be turned on and everything. He does have that IV pump over there. He also has some extras, so he has a chest tube, and it is right here on the floor, so it's there for you guys to assess. He also has a central line here.
Sorry.
And so you can see that there. So you will be expected to, do your assessment with that. He also has a Foley. I'm going to come over there. So his Foley is here. You are expected to assess the bag and look at what's in there. But you will just verbalize Foley care. So if you wanted to do anything like as far as care for the Foley, you'll just verbalize and walk us through that. Otherwise, he has chest rise, he has his heart rate. Remember that you're supposed to go through your landmarks. You can palpate 4 pulses, but you also need to listen. His eyes he'll blink. If you take your time, they are reactive pupils. So just kind of go through that.
I have one more thing I forgot to tell you. Excuse me. Your simulator, the central line that he has on him, there's a receiving bag underneath.
Oh, yes.
It's underneath the simulator here. There's a receiving bag. So everything that will infuse in this central line will go into this bag. So we will be obviously emptying this bag and making sure that everything is staying leak proof so that we do not have a mess with water and electronics. So just watch out for that. If you see any sort of leaking when you are in your simulation in this area, it could be coming from this bag. So please notify sim staff if that happens.
Perfect. I'm going to take you guys back over here so we can see the whole room again. So as always, Kristy and I are here for you. So if you have any questions, you guys can always reach out to us via email, and then you'll be ready for your simulation for Billy.